Guys, this channel focuses to discuss some important NEET PG topics. Stay tuned, do like, subscribe, comment, and share. So, guys, I'm back again with another similar type of video discussing the most important high yielding question in this your 5-minute break. So, I hope this will be helping you to get to know the important topics and the important questions. So, without wasting time, the trauma to breast causes which type of necrosis? So, fat necrosis, you all know, most common ovarian tumor, young ladies, dysgerminoma. Inhibin is the tumor marker for granulosa cell tumor. So, please make a note of the tumor marker for all the ovarian tumors. Vaginal adenosis is evident in women who have exposure to DES. Now, following is a statement true for hemophilia patients. Females are mostly carrier, all males are affected. Which worm causes myocarditis? So, Trichinella. Okay, so causes myocarditis. How you can remember? So you can remember it just by correlating or making any statement by which you remember it. Like I made Trichy may peoples have myocarditis. So Trichinella causes myocarditis. Trichy is a South Indian city. Bar bodies is absent in Turner's. Giant platelets are seen in Bernard-Solier syndrome. All the bleeding diastasis, again repeating, a very important. Most common malignancy in lungs is adenocarcinoma. LE cell is seen in lupus erythematosus. Now, Pegler-Hewitt anomaly shows presence of hyposegmented neutrophil. What accumulates in tissue in hemochromatosis? You all know. Comment in the section. Infraclavicular lesion of tuberculosis is known as Asman's focus. Very important and repeated question. Sentinel lymph node biopsy is used for melanoma. Interleukin 2 is produced by T helper cells type 1. Popcorn cells are seen in which variety of Hodgkin lymphoma? You will comment in the section. Okay, so it is predominant. Which isoenzyme LDH is seen in HERT LDH1? Smoking is not a risk factor for Alzheimer's disease. Okay, so here the relation is inverse. Most common site of, so don't start smoking. Okay, most common site of tuberculosis in gastrointestinal tract is ileocecal junction. Shape of Bieber granules is tennis racket. So they have asked many different questions surrounding or roaming around the Bieber granule. In one exam of AIMS they have given the picture and asked, so it's important. Annexin 5 is a marker for apoptosis. Lipid peroxidation of polyunsaturated lipid subcellular membrane produces lipofuscin. So basically it is lipid peroxidation. Ring chromosome is a result of deletion. So if you delete, it will form to a ring chromosome. Hairy cell leukemia, the marker is annexin A1. Okay, so I'll continue it. SRY gene is located on, so you will comment in the section. In hemochromatosis, iron is not deposited in. So it is a confusing question actually. The answer marked was testis. Premalignant bone lesion is seen in Paget's disease. Which of the following bone grafts have osteogenic properties? So it is the bone marrow aspirate. Pseudohypertrophy is seen in Duchenne's muscular dystrophy. So another very important topic, the different types of muscular dystrophy. If I find, I will make a separate video of it. Paraneoplastic syndrome, hyperglycemia of malignancy is produced due to ectopic production of which hormone by lymphoma? So it is 1,25-dihydroxyvitamin T. Phyllodes tumor most commonly present in the age of 6 decade. HLA-B51 with Behcet syndrome. PT is used to test extrinsic and common pathway. How I remembered is, you do the PT is that which we used to do in the school. We do it in the external environment, means something outside our class. In the extrinsic environment, that is PT is used to test is extrinsic environment, extrinsic pathway of coagulation. Which of the following is not a hereditary disease? So following are the hereditary, while cretinism is not a hereditary disease. Neurofibromatosis, Hutchinson's and hereditary spherocytosis are all hereditary disease. Plasma cells are derived from B lymphocytes. Following is the risk factor for cholangiocarcinoma. So primary sclerosing cholangitis as well as Clonorchis sinensis infection, both are a risk factor for cholangiosarcoma. Now, point mutation is seen in which proto-oncogene responsible for the development of GIST. So, KIT. Most common cause of aplastic anemia is exposure to drugs. Increased vascularity, increased vascular permeability in acute inflammation is due to histamine. Carcinoembryonic antigen is raised in which of the following non-neoplastic condition? So it is raised in pancreatitis. Under blood safety program, compulsory tests are done all except, so hepatitis E is not done. You can see in the blood bank bloods which you transfuse in the ward. Warthin tumor is multifocal and bilateral. So salivary gland tumor both important as a regard to the pathology as well as to the surgery part. 50-year-old male present with 2 cm right solitary pulmonary nodule on chest X-ray with a scalloped margin, and patient currently smokes around 12 cigarettes per day. What is the risk of developing invasive carcinoma for such patient? So there is a separate grading system. You can search it in your books. Intermediate risk according to the number of cigarettes he is smoking and all. Which of the following is the most common site for extrathoracic metastasis in patients with lung carcinoma? Is adrenal gland. So lung carcinoma is very important with regards to medicine. Read every aspect of lung carcinoma, solve the different MCQs regarding the lung carcinoma. Zollinger-Ellison syndrome is caused by gastrin secreting tumor. Epstein-Barr virus receptor mix CD21. Now leukocyte adhesion to endothelium is mediated by all except VCAM4. Now pathology is a important subject regarding your NEET PG. I have already told. I have discussed some of the questions. As I find time, I'll discuss with you more of these. Till then, stay updated, stay focused, stay motivated, and study hard. All the very best. This is Dr. Shivaam Kesarwaani signing off. Thank you.